Our next speaker, I'm thrilled to introduce to you. Because, when we think about our oral dental health, we don't think much about it, actually. And for many years, it has been sold to us that our mouth is not really connected to the rest of our body, that our teeth are not a part of our optimal health and well-being. So the next person who's going to come up, he's not only a dentist, integrative dentist, but he also is a naturopathic doctor. He's licensed as both a naturopath and a dentist. So he looks at your body as a complete and total entity. And he uses all natural substances to help create optimal health and well-being in your body via the mouth. My great pleasure to introduce to you the one, the only, Dr. Alex Shvartsman. My pleasure.
I just wanted to let all of you know that I've been working with Dr. Robbins for a while now, a couple of years. I've been referring patients to him, and it's really remarkable what ozone therapy does. We actually have ozone, medical grade ozone in our practice as well, and it's been nothing short of remarkable. I want to call it miraculous, but it's really remarkable. It's biological, and stuff is really amazing, and it's underutilized in our country, which is the true shame. So today I'd like to talk to you about a healthier approach to dental care. The dirty little secret and the sad truth is that dentistry is based on 1800s techniques. These ancient, old, outdated techniques are still taught in every single dental school in the United States, and is responsible for ruining a lot of people's teeth and possibly their health. Fortunately, in the 21st century, we have now access to a different approach to dental care. And I'm embarrassed to tell you that my colleagues, when I try to talk to them about this, they are not interested. I don't know why, but they're just not. There's very few dentists that I've met that are open-minded to a more natural and more integrative approach. So dentistry basically was developed in the early 1800s, and it's based on woodworking principles, because dentists are taught to treat teeth like little white rocks and not living structures that are part of your body, part of the biologic system that we are. And you could take these little white rocks and you just whittle them down to whatever shape you want and stick some man-made objects on them or in them. And that's dentistry. Dentistry is basically carpentry. You are a tooth carpenter. And I didn't go to school to be a tooth carpenter, although the truth is, that part of dentistry I enjoy the most. It is what gives me it is my artistic outlet. So I actually enjoy every filling I do, even a little one, because I get to create art inside your mouth, and it gives me my artistic outlet. So, however, I did not go to school and didn't spend over $1 million in education into myself to be a tooth carpenter. I trained myself to be a healer, a doctor, and that is what I want to do, and that's how I basically treat my patients. Because the truth is, it all comes from caring, because I care first. I don't care about how much money I'm going to make. I care about my patients. And I think that's what every doctor should be doing, leading with caring, not with how much or how much profit you can make. I'm not saying doctors don't deserve to make a living. We all do. And certainly some of us who spend $1 million into their education probably shouldn't be paid $5, an hour from the insurance company. So the approach that we have taken in my practice is basically redesigned dentistry. And what we do is, the truth is, modern dentistry has some pretty awesome things in it, especially in the diagnostic realm. So modern dentistry has new equipment, lasers, imaging technologies, that allow us to be less invasive to our patients and understand what the cause of their problem is. Because in medicine, it's very important to treat the right cause. If you're treating the wrong problem, you're not helping your patient. And oftentimes, because of lack of diagnostic technology or lack of diagnostic information, we treat the wrong problem. So modern medicine has really helped me to become a much better detective to ferret out the true problem or the true symptom of what the patient's suffering with. But it is in the how that we really have changed. It's how we deliver care. There are a lot of very toxic materials in dentistry. And if you see me at the Naval Expo in Melville in the city, we're going to do a really great talk on controversies in dentistry, which I'll go into detail about every single thing that you guys are probably worried about or should be worried about. So I believe that I've tried to help to educate my profession. My profession spat in my face. So I've decided to go to the people because I really believe that it's from the people that true change will come. We've seen this in the food industry. We see it every decade. You know, when low fat was hot, Snackwell's made low fat cookies. You know, low carb is hot. You know, there's low carb bars. So the industry goes where the money is, and if more people vote with their money and shop in organic farms, Whole Foods, Trader Joe's, versus other food establishments, and we vote with our money, with our dollars, then the food industry will change to fit our needs. And I'm a very big believer in patients being their own healthcare advocates. I am not any smarter than any one of you. I just know a lot about teeth and health. And I think the problem with doctors in general, and probably know that in industries as well, is we do a very bad job explaining things to people. We use Latin words, a language none of us can really speak. So I call it medicalese or dentalese. And what happens is when there's no communication, patients don't understand what's happening to them, and they cannot make good healthcare choices for themselves. So I think it's the responsibility of healthcare establishment in general to speak English to our patients. I certainly try. You know, you don't need to know that you all know I'm a doctor and I learn Latin words. You all know that. It's more important for you to understand what I'm saying so you can know what's going on with you. That's another pet peeve of mine in medicine. So today, dentistry, with this amazing technology of lasers and ozone and materials that mimic the physics and the natural construction of the teeth, today in 2015 and forward, it's really amazing what we can do. We can provide dentistry in a less toxic manner, possibly an untoxic manner, with restorations that mimic nature, using more natural medicine to help us. You know, to reduce inflammation, instead of taking ibuprofen, maybe a doctor like me will recommend turmeric instead and other anti-inflammatory natural medications. You know, the problem with synthetic man or human-made medications is they are synthetic. We are creating molecules that our biology, this organic machine, hasn't seen before, and our body doesn't know what to do with it. Our body just works better with nature, with the molecules that nature has created. It just works better that way. There's less side effects for that reason. So today I'm able to provide dentistry in a minimally invasive manner using healthier materials. While the majority of my profession either doesn't care or doesn't know and continues to poison the patients. There's mercury, there's glutaraldehyde, there's nickel, there's many other toxins and carcinogens that are routinely used in dentistry, primarily because they were grandfathered in. And the sad thing is, every dentist in this country has access to everything that I own and have, to my technology and to the education that's in my head. but they're very resistant to going outside that conventional dental box. And I hope more dentists will join me. I'm very fortunate. I found 3 others who think like me, and 3 others who want to provide dental care in this manner. So my practice, we have 3 other dentists. We have another restorative dentist like myself that we fix teeth. We have a specialist who's a surgeon who does gum surgery, bone grafts, and other surgical procedures. And we have a root canal specialist who was very open in learning a completely radical way, completely different way of performing root canal therapy that's actually healthy and not going to ruin your body. And he was willing to go through all the training, fly all over the country to study this and learn it and become awesome at it. So I'm very proud of the team I've put together. My practice, we only hire happy, nice, friendly people. There is no grumpy people in my office. When you walk into my practice, you're going to see smiles and teeth. There's no grumpy lady saying, "What's your insurance?" instead of "hello, welcome." So we don't play that way. We treat people like people. I think it's important. I think common courtesy is going away, and when people are treated like numbers and pieces of paper, not human beings, bad things happen. And the quality of care goes down. You know, we all want cheap care or free care, but we want the best care. So, you know, I've invested millions of dollars in technology into my office so I could provide the best care to my patients. If I just worked for the insurance company, I couldn't afford to do that. And I would feel like a failure and an empty doctor. So I like to be happy. I like to live my dream and do what I love to do, which is to help and heal people. And I like to surround myself with other healthcare providers like Dr. Robbins, Dr. Hugelmeyer, who are cut from the same cloth. And I'm very proud to share the stage and the island with you. So thank you, everyone. As a little treat for those who came today, you'll get a free copy of my book if you want, and as well as a $100 coupon for your first visit to save you a few bucks. So if you want to try out my office, kind of see if we actually walk the walk, it'll cost you $75. That's it. So, and I want to offer it to the people that are here. So thank you.
Thank you.
Thank you.